The two main options that we discuss with patients in terms of breast reconstruction surgery are, number one, using an implant-based reconstruction, or two, using your body's own tissue, what we call an autologous reconstruction. DIEP flap, DIEP, DIEP flap stands for Deep Inferior Epigastric Perforator Flap, which is really a mouthful. But really what it means is taking the tissue from your abdomen, so taking the fat and skin from your abdomen, finding the blood vessels that feed that piece of tissue, dissecting down carefully through those muscles until we find the origin of those blood vessels, and then cutting the blood vessels and transferring them into your chest and sewing them together to blood vessels in your chest. One of the things that's really great about DIEP flaps is that it really balances out a woman's body after a mastectomy. So a lot of patients come to us and they have a lot less tissue on top and a lot more tissue on the bottom. Particularly, sometimes chemotherapy will cause patients to gain weight. So with a DIEP flap, we're essentially doing a tummy tuck at the same time as using that tissue to make a new breast. As you'll be able to see in our before and after pictures, if someone has extra tummy tissue that they want to get rid of, using that tissue to make a new breast is rebalancing the whole body, really rejuvenating the whole body, and it's all something that can be covered by insurance. One of the most important things to understand is that if you have had a breast reconstruction already and it is an implant-based reconstruction, it is definitely possible for you to still have a DIEP flap reconstruction. And it is also possible for us to do resensation surgery to bring new sensation back to your breast, even if you hadn't had it before. I was fortunate enough to train for many years with Bob Allen, who was the person who invented the DIEP flap and the person with the most experience with it. And everything about his philosophy, which is what I've adopted, is about doing everything we can to spare the patient's muscles, to spare the patient's nerves, to spare everything possible, and to use your body's own tissue to make a soft, natural looking breast.